I'm Zita, and I'm sitting here with Jessica, who has graciously volunteered, and her puppy Zoe. Hi, Zoe.
Hi, baby.
I will not be taking Zoe's blood pressure today. Jessica, you have agreed to participate in this with me.
Sure.
We are starting you off as a client, and so this is the first time we've ever discussed any of these tools.
Sounds good.
It was hard for me to find someone who hasn't participated in 75 or so videos I've already made. So I'm going to introduce you to these tools, and we're going to take some really basic metrics today. We'll do a follow-up video where we do some more in-depth metrics, but that's not until the next assignment, so I'll hold off on that.
All right.
Spare you from the agony. This, Jessica, is the 2016 PAR-Q Plus. I'm just going to read to you this top introduction here. The health benefits of regular physical activity are clear. More people should engage in physical activity every day of the week. Participating in physical activity is very safe for most people. This questionnaire will tell you whether it is necessary for you to seek further advice from your doctor or a qualified exercise professional before becoming more physically active. The reason that we do this, honestly, is because my scope of practice doesn't extend into ensuring that you are safe to exercise. So, if you answer these questions in a way that provides me information that allows me to proceed safely, then we can move forward. If for whatever reason you answer no to some of these questions, you've never seen these before, so you very well might, then there are follow-up questions where we'll get a bit of a better picture. These follow-up questions will also help me decide if we need to set you up with what we call a PAR-Med-X, which is where we send you to a doctor, just get the doctor to sign off on it. The vast majority of the population is cleared to exercise. The reason why we do this is because some members of the population have special considerations. So if you were on specific medication that might alter your heart rate, all of that stuff, that would impact how I train you.
Yep.
Cool?
Yep. Sounds
So this is our 2016 PAR-Q Plus. I will read them for you just because we're filming, but I also trust that you can read. So, Jessica, has your doctor ever said to you that you have a heart condition or high blood pressure? No? Awesome. Do you feel pain in your chest at rest during your daily activities of living or when you do physical activity? That is a good thing. If you did, we'd want to chat about that right away. Do you lose balance because of dizziness or have you lost consciousness in the last 12 months?
No.
Awesome.
I lose my balance because I'm clumsy. So.
Yeah, you've actually mentioned that before. You're clumsy by nature.
Left foot, right foot's terrible.
We need to work on stability for you. There are so many things you can do to improve stability. Like it's funny because we don't think it's something that you can train, but you really can.
Yeah.
Make you a better ball player. Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure?
Tuberculosis. Got it.
Tuberculosis.
I'm positive for TB. Yeah.
Oh, I didn't know that.
Yeah.
So do you take any medication
No,
for TB?
I took some when I was 5, and other than that, just prophylactics and how to get a regular chest X-ray. Everything's fine.
Does it impact your ability to exercise at all?
No, it's just when I get sick, I notice.
Fair enough. And you're already physically active?
Oh yeah.
Yeah. So okay, good to know. But that's actually a really interesting thing, and I would probably we'll go and take a closer look at that. If that's okay. Are you currently taking prescribed medication for a chronic medical condition? So that can be medications that are daily, or it can be intermittent. If you have to take a bronchodilator or something. No.
No.
Okay.
Nothing
Cool.
like that.
Do you currently have or have had within the past 12 months a bone, joint, or soft tissue, muscle, ligament, tendon problem that could be made worse by becoming more physically active?
Yes.
Yes. Tell me about that.
Shoulder injury. It's been happening for years from baseball.
Okay.
Yeah, I don't know if you can hear this.
Yeah. What's happening there?
That is
An angry rotator cuff.
Yeah, that is from playing too much baseball.
Okay,
too much backhand.
Fair enough. So overuse injury.
Yeah.
Have you consulted a professional about that?
Yeah, I saw a physiotherapist for that and my knee, but my knee was a few years ago.
And at any point have they told you that exercise would make that worse?
They did, but they said just don't lift anything too heavy, in this direction. And they said be careful of what you're doing. They said just be wary of how much you're lifting and the angles that you're lifting at.
Okay, so I'm going to put down that you have a rotator cuff overuse injury, that you have consulted with a physio, and because it is something that's still kind of aggravated for you, I'd probably send you to get clearance on that, just from a doctor to say,
Yeah.
we are able to move forward. The good thing is that at NAPE they also reinforce what's called corrective exercise.
Yeah.
So I'm actually trained to help support that, make sure that we don't aggravate it.
Yeah, I use bands. I use exercise bands just to try to strengthen. So
Awesome.
That's
For sure. Has your doctor ever said that you should only do medically supervised physical activity?
No.
Okay. So because we have said yes to some, and I sure wasn't expecting that. Sorry, guys.
Sorry.
This is the problem. You can't say make sure that you've never dealt with stuff. The
Yeah.
person's never, know what I mean? That they're a new
Yeah.
person to you, and also know what your medical
Yeah.
history is, right? But the good thing is that this is a real life example of how this works. So we're going to go through. We answered yes to one or more of the questions above. So we're going to take pages 2 and 3.
Sounds
Do you
good.
have arthritis, osteoporosis, or back problems?
In my hands.
In
Only
your
arthritis.
hands?
Yeah,
Okay.
that's fine.
Have you ever been diagnosed with that?
Nope.
Okay.
I just know it hurts.
Okay. Do you currently have cancer of any kind?
Nope.
Do you have a heart condition or cardiovascular condition?
Nope. I just threw a lightsaber.
That was what it
That
was.
was
I
your
thought it was a
husband.
cat. Do you have high blood pressure?
Nope.
Good. Do you have a metabolic condition? Type 1 diabetes, anything like that? No? Awesome. Do you have any mental health problems or learning difficulties?
Nope.
Do you have a respiratory disease?
Well, yeah, now. Yeah.
So technically, yes. Do you have difficulty controlling your condition with medication?
Nope.
Has your doctor ever said your blood oxygen level is low at rest?
Nope.
Or during exercise?
Nope.
Do you require supplemental oxygen therapy?
Nope.
Good stuff. If asthmatic, do you currently have symptoms of chest tightness, wheezing? Nothing like that?
Nope.
Okay. Consistent cough? Nothing? No? Cool. Has your doctor ever said that you have high blood pressure in the blood vessels of your lung?
No.
Excellent. Do you have a spinal cord injury?
Nope.
Have you had a stroke?
Nope.
Do you have any medical conditions not listed above? And do you have 2 or more medical conditions?
No.
No. Excellent. We'll go to page 4. So, if you answered yes to one or more of the follow-up questions, now I'll show you that I answered no to arthritis, and the only reason why is because it's not diagnosed.
Yeah, exactly.
That
It's
being
just sore.
said, I would
Yeah.
want to make sure that we know that we have sore and sensitive wrists. I would encourage you to have that checked out.
Yeah. See that?
I would encourage
Yeah.
you to have
No, it's just a cyst.
fair enough.
Yeah.
But the earlier that any sort of bone and joint issues
Yeah.
are diagnosed, the earlier that treatment can
That's
be
true.
applied.
Yep.
Right. So it's something that's worth looking into. Best case scenario, it's not arthritis, and it's just we've got some soreness happening in the joints and ligaments. Worst case scenario, we can start intervention.
Yeah.
So, but because we said no to all the follow-up questions about your medical condition, then we get to say it is advised that you should consult a qualified exercise professional to help you develop a safe and effective physical activity plan. Hi! You are encouraged to start slowly and build up gradually. The good thing about you is that you're already very physically active, so you know your limitations very well. As you progress, you should aim to accumulate 150 minutes or more of moderate intensity activity per
No
week.
problem.
And if you're over the age of 45, you're not,
Nope.
or are not accustomed to rigorous physical activity of maximal effort, consult a qualified exercise professional for engaging in this intensity. Okay?
No problem.
I'm just going to let you know, if you have any sort of temporary illness such as cold or fever, hashtag don't go there. But
Sore
no,
throat right now.
yeah,
Yeah.
this is not usually the best time, especially not with a history of TB.
Yeah.
In general, the body needs to recover. We should let it do that. If you're pregnant, talk to a healthcare practitioner, so on. And if your health changes, talk to a doctor. All right. Informed consent, I'm going to let you read this
Yep.
document.
Sorry, puppy.
So this is just
Oh,
outlining.
I like the part where you're gonna measure me. I do really well at this part. I'm good at measuring.
Again, we're not going to do that today. The only other thing that we have to do is blood
Yeah.
pressure.
Cool. Sounds good.
Alrighty.
There you go.
And we'll get all the witness signatures afterwards.
That's what, the 15th today?
Yes, it is. I'll get you to sign here as well. This is just the follow-up to your PARQ. And then I'm going to do a blood pressure reading with an electronic cuff.
Sounds good.
As a nurse, you would know that I am not
Former.
not trained to properly do a blood pressure reading with a stethoscope. So I'm going to use this. If for whatever reason it gives me a reading that's abnormal, then I would again indicate to you that you should probably see a practitioner. This will also give me a heart rate. Based on that, I might look at whether or not we want to do a manual heart rate as well. So we're just going to put this on. I'm going to make sure that this lines up with your arterial line right here. And then up and around.
Tiny arms.
There we go. Tiny arms, yeah. So about 2 centimeters off. Good. Left arm at rest, just hanging out there. Try and relax. Try to keep it immobile, and try to keep the rest of you immobile too.
Yep, that's
Perfect.
about usual. Yep, that's
what we're
low.
expecting to see. So it's on the lower side. It's not in a dangerous kind of range.
Always been low. It's
but
been
that's what you were telling me
yeah.
to kind of expect.
Yeah.
So number 81. And I've got your pulse down at 69,
Yep.
which is again exactly what you told me to expect. If I were doing a manual pulse check, I would be pulse checking here. I would be doing so for 15 seconds, and just to demonstrate that, I am going to, if that's okay with you. You said it's easier to read on this side.
it's easier to read on that.
So,
for sure.
I'm going to start now. Okay. I've got you at 68, and our reading here was 69, which
Yep.
is bang on. Jessica, that's all I need from you.
Yeah, no worries.
Today. As I said, I'll probably do some follow-ups with you for the next assignment, just because it's part B of kind of a
Sounds
two-part
good.
assignment.
You do what
Thank
you
you so
do.
much for your participation.
You're welcome.
Thanks so much, guys. See ya. TV, really?
Yeah.
Cool.